Welcome to the UT Health East Texas Virtual Education Series. Today's presentation topic is mental health and substance use disorders, featuring Sonia Hampshire, psychiatric nurse practitioner at UT Health East Texas Behavioral Health.
Hello everyone, my name is Sonia Hampshire. I am a psychiatric nurse practitioner. I'm also certified to treat patients that struggle with substance use disorders. Currently I work for the University of Texas Health Science Center in Tyler, a part of UT Health East Texas. Today we're going to discuss mental health disorders as well as substance use disorders. We will start out with defining the illnesses, and we will also discuss the treatment of these types of disorders, and we'll wrap it up and ask questions towards the end. The definition of a mental health condition is any condition that's characterized by cognitive and emotional disturbances, abnormal behaviors, impaired functioning, or any combination of these. A substance use disorder is defined as a complex condition in which there is uncontrolled use of a substance. People that have a substance use disorder have an intense focus on using the substance. Those types of conditions can actually move over into an addiction. So if someone has a substance use disorder, that can lead to a full-blown addiction. Addiction is actually more well-defined and graspable. It is a treatable chronic medical disease that involves complex interactions among brain circuits, genetics, and an individual's life experiences. These people still struggle with substance use, even if it's affecting the functioning in their lives, such as their relationships, their jobs. So what we're going to actually go over next are some examples of conditions that are mental health disorders, and then we'll also go over conditions or examples of substance use disorders. Some of these you may have heard before, so we will first start with mental health disorders. An example is anorexia. That is a type of eating disorder. Bipolar disorder is another example. Generalized anxiety disorder, insomnia, major depressive disorder, obsessive compulsive disorder, post-traumatic stress disorder, as well as schizophrenia. Some examples of substance use disorders include alcohol use disorder, which is the most common substance use disorder, benzodiazepine use disorder, cannabis use disorder, cocaine use disorder, inhalant use disorders, methamphetamine use disorders, as well as many of you have heard of opioid use disorders or opioid addiction, which is another type of a substance use disorder. Many people think that mental health and substance use disorders are not very common. Mental health disorders are actually considered some of the most common types of illnesses. Each year, about 1 in 5 will experience a mental health condition over the course of that year. About 1 in 25 persons actually suffers from a serious mental health problem such as schizophrenia or bipolar disorder. Sadly, only about 60% of patients, 60% of patients do not receive treatment, and only about 40% do receive treatment. So again, that's over half that do not receive treatment, unfortunately. And since COVID-19, the frequency of Americans that report symptoms of anxiety, depression, and insomnia have increased substantially. Many of those have actually quadrupled. And then how common are substance use disorders? Well, actually about 1 in 12 persons suffered from a substance use disorder in the past year. It's fairly common. The most common substance use disorder, as we talked prior, was alcohol use disorder. Alcohol use disorder is actually about 71% of all substance use disorders. Unfortunately, in the last month, about 1 in 4 adults engaged in binge drinking. That's a very, very high statistic. 50% of the people that suffer from a substance use disorder also have a mental health problem or a mental health disorder. What is really unfortunate is with substance use disorders, about 90% of those patients suffering from substance use disorder do not get treatment. And then lastly, in the past month, about 1 in 10 persons used an illicit drug, which is, for instance, heroin, methamphetamine, cocaine. Next, we'll talk about myths and facts. Here in East Texas, there is a stigma, as there is in most of the country, regarding mental health problems and substance use disorders. I believe that actually COVID has more or less started to normalize a little bit of the suffering as far as reduced stigma, because isolation anxiety is increased substantially with the COVID pandemic. So first we'll talk about myths. The first myth is, oh, if you have a mental health problem, you just need to pull yourself up from your bootstraps, or you need to pray more, you need more willpower. That is not the case with mental health problems. Mental health problems are defined as complex illnesses which involve genetics as well as childhood trauma, experiences, and neurobiology. The next myth we'll talk about is that people with mental health problems are violent. Well, actually, that's a myth. So the facts here that people with mental health problems are actually 10 times more likely to be the victim of violence rather than the perpetrator. And statistically, only about 3 to 5% of violent crimes are actually perpetrated by those with mental illness. And that's a very, very common, myth about mental health problems. Next is that many people think that mentally ill persons cannot hold a job. Again, that is inaccurate. For the patients that I serve at UT Health North Campus, I'm proud to say that the majority, probably approaching 80%, work and are fully employed. And so that is a very, very common misconception. They can hold jobs and function. The next thing is many people think that children are not impacted by mental health problems. And then again, that is inaccurate. About 50% of mental health problems actually start around the age 14 or even sooner. So many people also, I hear that they believe drinking alcohol or smoking cannabis, marijuana is the other term for it, helps their mood or their anxiety. Unfortunately, that is inaccurate, and over time, those substances actually worsen symptoms by altering the effects of certain chemicals and neurotransmitters in the brain. Over time, it can even develop into a substance use disorder. Certain substances are only self-medicating for different symptoms that really need mental health treatment. So the self-medication aspect is not helpful, especially long-term. And then lastly, another myth is methadone and Suboxone, which are two medications for opioid use disorder, trade one drug for another. And that is a very common misconception that family members of patients I serve may tell me, well, why are you going to prescribe this medicine? It's just going to replace the heroin, for instance. And that is absolutely not true. We know where medication comes from. It's from a pharmacy for Suboxone and also for methadone that's given at methadone clinics. It's known where it's produced. It is not laced with fentanyl. It is a controlled medication that helps people get their lives back together. Okay, the next section is actually going to be on treatment, which is an exciting aspect of our discussion today. So with mental health and substance use disorders, treatment actually works. There are so many professionals and just the general public that does not believe treatment is effective for mental health and or substance use disorders. So remember, treatment works. Treatment is effective. It's available for you. That's the great news, and I get to see treatment and its effectiveness every day at work, so I really enjoy seeing patients get well. All right, so how are these illnesses treated? So we'll talk about specific targets for treatment, which would be therapy, and then other targets like medication. So different types of therapy are cognitive behavioral therapy, dialectic behavioral therapy, and then generally, our program also helps with coping skill development to help with things like anxiety, cravings, negative thoughts. Group therapy is evidence-based. It's been found to be just as effective as treatment in a one-on-one setting, as well as motivational enhancement. So the other side of the coin is medications. So medications are also very effective. The most effective treatment for mental health and substance use disorders are typically a combination of both medication and therapy. Some examples of medications that we use are medications for depression called antidepressants, medications that help stabilize the mood, and then medications for sleep. And another is called medication for addiction treatment, which is abbreviated as MAT. And then also long-acting injectable medications can be helpful for many. We also will treat withdrawal from alcohol and certain drugs as well with medication. So a few things that we'll go over that are particularly, to me, exciting about treating patients with mental health disorders. One is that we talked about treatment is effective. Another thing that we utilize is called the medical model. That means that looking at a mental health disorder or a substance use disorder, looking at them both as a medical illness. They're chronic, they're relapsing, they respond to treatment, but without treatment, they tend to get worse, and it can even lead to mortality or death. So with substance use disorders and mental health problems, the relapse rates are actually comparable to other chronic medical illnesses such as diabetes, high blood pressure, asthma. Substance use disorders are, again, considered chronic relapsing, as are mental health disorders, so that means they need ongoing treatment. Mental health and substance use disorders can certainly worsen over time, but the goal is treatment and to improve quality of life, improve functioning, control symptoms. And the next area we're going to discuss is how could you get help for yourself or for a loved one that's struggling with a mental health disorder or a substance use disorder, or both. The main thing to start with would be understanding what to look for. So if you don't know what the warning signs are, you're going to have difficulty pointing those things out and getting into some treatment or reaching out for help. Some of the warning signs are prolonged feelings of sadness, constantly worrying, feeling emptiness, and you'll notice maybe family members even withdrawing from the family unit, staying isolated in a room. If a loved one or yourself struggles with seeing or hearing things that other people do not hear or see, then that would be a red flag or a warning sign. Also, low motivation, poor focus, difficulty with concentration are some key warning signs as well. If someone's losing control over their substance use, whether that be alcohol or drugs or both, then that's a warning sign. And then, of course, if someone's making if someone's making statements or reporting having thoughts of wanting to harm themselves, that is a warning sign as well. If they're, of course, having thoughts or, making statements of harming others, that also is a warning sign. So resources that are available listed on the slide. So first we talked about the warning signs. Next, we need to know what to do with that information, how to get adequate resources. The program I work for is the UT Health North Campus Intensive Outpatient Program. It is a very effective treatment program. It's evidence-based, and we take patients that have mental health problems as well as substance use disorders. But we actually take those that have both, which is unique about our program. Many facilities and locations only treat one or the other, but our program provides what's called dual treatment. We provide treatment for both illnesses simultaneously. Other options include the UT Health North Campus Behavioral Health Outpatient. That program provides care on an outpatient basis, such as medication management and one-on-one therapy. Other resources are listed as well on the slide, including the Andrews Center, the East Texas Council on Alcohol and Drug Abuse, as well as calling just 211 will help assist you in getting resources if you're not sure where to turn. For additional resources, please go to our website as listed on the slide. So we'll discuss more what IOP is, Intensive Outpatient Programming, the location I work at and take care of patients that have these types of disorders. As discussed before, the treatment is effective. It's individualized. We use evidence-based care. Our program provides free screening for patients that are interested in our services. We provide intensive group support, group therapy support, Medication management is also included for mental health disorders as well as substance use disorders. We also provide flexible virtual sessions. So we have patients that can live various places in the state of Texas that will be able to attend our services because many of them are able to be done virtually. We offer mental health groups, recovery groups for those with substance use disorders, trauma groups, and we have specialty topic groups that we offer. Our team includes several highly skilled clinicians, including providers, nurses, therapists, and other healthcare staff. We are actually located at UT North Campus, and a referral is not required. If you would prefer a referral, primary care may be able to assist you in getting a referral over to us. We are compassionate and knowledgeable caregivers. Our treatment is covered typically by Medicaid, Medicare, and most insurance plans. For a free screening, call 903-877-5560, and we'll be happy to help you. Another service offered by UT Health East Texas is called Step 1. Step 1 is a 3 to 5 day inpatient detox for patients needing to withdraw from alcohol or opioids. They also accept most insurances such as Medicaid, Medicare, and commercial insurance. The staff at Step 1 are involved in the admission process for patients needing hospitalization for alcohol or opioid withdrawal treatment. Many people think that withdrawing from alcohol on their own is safe, but it can actually be very harmful and even lead to complications such as delirium tremens or even death. So absolutely, treatment is very important for alcohol withdrawal as well as other substance use disorders. If you would like more information for Step 1 services, you can call 903-213-3893 from 8 a.m. to 4:30 p.m. Monday through Friday. And you can take that first step to getting help, which is the detox portion. Lastly, the specialty topic is on essentially crisis collision. So what that means is the pandemic, COVID-19 pandemic, and suicide rates being elevated, as well as opioid overdoses and the opioid crisis. So you may ask, are people using more drugs and alcohol during the COVID pandemic? Yes, the data indicates that people are using substantially more substances from opioids to alcohol. Many heard that when the pandemic started that alcohol was one of the first things to fly off the shelf. However, suicide rates actually appear at this point to be stable. There are no clear indicators that rates have increased. The highest rate of opioid overdoses and deaths have occurred during the COVID-19 pandemic. And many people call opioid overdoses and suicides deaths of despair, and I think that's a great way to talk about such a horrible topic, but they are deaths of despair, absolutely. Risk factors for suicide include isolation, which many people are experiencing during the COVID-19 pandemic, having physical health problems such as illness and general medical illnesses, chronic pain, increased stress, loss of job, relationship conflict, many of these things that are experienced during the COVID-19 pandemic. It's believed that social isolation and stress related to the pandemic contribute to increase in substance use and many people struggling with a relapse. As a community member, you may consider educating yourself on mental health problems, substance use disorders, COVID pandemic, as well as suicide risks. You may consider raising awareness and volunteering to help others. Please avoid spreading misinformation. There's a lot of poor resources online available. Next, we'll talk about suicide prevention. Really, we'll talk about the facts. Suicide is the second leading cause of death for those aged 10 to 34 years old. Suicide is actually the 10th leading cause of death for the general population, which would include all ages. Suicide has sadly surpassed the deaths from motor vehicle crashes, so our rates are very high for suicide. Males make up 75% of completed suicides. One thing that needs to be brought up is asking about suicidal thoughts. Many people believe that if you ask someone if they're feeling suicidal or having suicidal thoughts, that you would give them the idea. That is inaccurate. We should ask others if you have concern that someone's depressed or anxious or having these types of thoughts. It's imperative that you ask, are you having thoughts of harming yourself? People with mental health disorders and substance use disorders are about 20 times higher risk for suicide than the general population, which are those patients I serve that have both mental health and substance use disorders. About 1 in 4 suicides that are completions include alcohol intoxication at the time they ended their lives. And acute alcohol intoxication is actually present in 30 to 40% of suicide attempts. On this slide, it's from NAMI, the National Alliance on Mental Illness, a simple flyer for suicide prevention. It also has some of the statistics that we talked about in the prior slide. Understanding who is at risk of suicide is important. If you know the risk factors, you can better identify those that you love that may be at risk of suicide. There is a new 3-digit number. Of course, we think about 3-digit number 911 to call if we have an emergency. There is now a number 988 that you can call or text if you're having a mental health crisis such as suicidal thoughts. So that number is a new number option for the general public. And again, that number is 988, and that will be able to get you in touch with compassionate care and support for mental health related distress or suicidal thoughts. And remember, there is always hope. The next thing we'll discuss, and we're getting pretty close to the end of the discussion, is the opioid crisis. So everyone's pretty much aware of the opioid crisis. Like we talked about before, the COVID pandemic going on, that's the highest rates of death from opioid overdoses that's ever, been seen during the pandemic. So one thing that's important for everyone to know is that you can access Narcan. Narcan is available in injection, or nasal Narcan is typically what most persons would get over the counter. It's actually available over the counter. So nasal Narcan can reverse an opioid overdose and save someone's life. There are free resources on how to access Narcan and how to administer Narcan with educational videos that are available at www.morenarcanplease.com. You can get additional information and training. Your local pharmacies, typically CVS or Walgreens, can also help you find out how to get Narcan over the counter without a doctor's prescription. One increased risk for opioid overdose is actually the lacing of fentanyl. Many of the products accessed illicitly, such as prescription pills, are essentially made by drug cartel and laced with fentanyl. It takes a very small amount of fentanyl to kill someone. A lot of the pills on the streets are being pressed that are not actually pharmaceutical pills. They are putting things that are not part of, that medication in these pills. For example, oxycodone. That is a common medication that's sold on the street that looks almost identical to the prescription oxycodone. Prince died from fake oxycodone. So if Prince can die from it, I think locally our citizens are at risk if they're getting fake prescription pills off the street. The DEA has identified that the majority of prescription pills bought on the street or illicitly are laced with fentanyl. Remember, though, Narcan can save a life. Remember that treatment works. Here are a few questions that we received. The first question is, can someone get over a mental health problem without medication? This is a very good question. Thank you for your